So when we're talking about intake forms, something that you want to use in your home practice or your business, there's just a few things you want to look for. Again, when you're doing an intake form, you can find them online, in massage books. You can make a printout of one from a massage book, or you can write up your own. There's really no right or wrong way to do it, but there are a few key things you would want to look for when you're creating your intake form. The things you're going to really want on there would be the person's name, so the person you're working on or your client, their name and their information, so their address, their phone number, email, maybe even an emergency contact in case something went wrong. And then any issues that they're having, you can have like the little anatomical men on there, and that's kind of something you're going to find online or in a massage therapy book. I've noticed they're really hard to find in like clip art or something, but you can usually find little atomic men that are facing different directions where the client can mark on them where they're noticing issues or pain or anything like that. And then another thing you're going to want is their past history of illness, disease, surgeries, anything like that, and then a list of their medications. And you can list some of the common ailments or diseases on your chart and just have them circle it, or you can just have them write out any past ones that they've had within the last 5 years. Surgeries are going to be a big one, medications are going to be a big one, and then of course cancer is going to be another big one. So if they're on any kind of certain medications, it's going to affect the way that the massage treatment goes. Because for different medications, someone's going to either have high or low blood pressure, diabetes, any kind of heart disease. Things like that are going to affect the way that the massage treatment's going to go, whether or not you do light or heavy pressure. Another thing you're going to want too is if you're working on someone that you don't know very well, it's not a family or a friend, and you're kind of worried about getting sued and you don't have insurance or liability or anything like that, you're going to want to have a little waiver at the bottom of your form. And then just can state anything from, that you're not going to be held responsible for anything that happens, and then just make sure that they sign, print, and date that. And then that's something you can keep in their file and refer back to whenever you're making treatment plans or when you're doing soap notes, which we can also talk about a little bit later.